Hello, good evening. Give me a minute. Good evening. Good evening. I'm very tired. I just got back from church. So we'll be doing a recap on the fibroids. That's what we're about to do. Please give me a minute. Sorry. Give me a minute so that we start. So that more people will join, because the questions, according to doctor, the questions that people asked him when they called. Hey, this thing is not going through. It's as if we didn't cover, like maybe we were a bit too technical and we didn't cover everything. So we want to answer questions. We are not going to go today. We are not going to discuss the whole thing over again like we did the last time. We will just tackle people's questions and then see to their concerns. Like make the whole thing very practical. Like very, very practical. That's what we seek to do this year. As you can see, I didn't make any noise about it because it was a last minute decision that we made. A couple of people has been to see him, and the feedback I'm getting is great. Honestly, the feedback is great, but he's also concerned about some of the questions that some asked when they called him. So he feels we need to address the whole thing again, so that we can be done, like we can cover every angle. So this thing is not working. This thing is not working. So I'll be inviting him in a bit. A couple of people have left comments that needs to be addressed, so I will call him and then please, if you want to leave any questions, kindly do. Patrol and bow transfer name, but I think there is something wrong with there. So me test it. Let me test it. But me test it. Why? Yeah, so I'm going to invite him in a bit, and then we can decide what to do with it. So what is this YouTube thing? Stop this one. Okay, are we ready? Am I audible? Can you hear me properly? Please let me know if you can hear me well. Give me a minute. Let me tell these kids to keep quiet. I'm sorry now. Parents would you need a special grace to be able to sort it, to be a parent. I'm calling doctor to come online. Okay, thank you very much if I'm audible. So that we would be able to cover this. I don't want us to take I don't want this to take our time, so I'll give him the audience and then he will do the teaching and we'll be over and done with in a bit. so that I can invite him to join. I'm adding him. I've sent the invitation. Okay, so I've sent an invitation. I don't know. Yes. Okay. Great.
Can you see me?
No, I can hear you.
Okay. I've also sent you an invitation. Try to let's see.
Okay, hold on. I can hear you. You are very audible, but let's see. Yes, send an invitation. We also have mastered this from last week.
Okay.
Yes, I can see you.
Ah, today I can see
You
you.
can see. Last week you didn't see me.
Last week I didn't see
Yes,
you, but today it
yes,
looks
last
like
week.
today I
Last
can
week
see
you
you.
didn't see.
And I'm going to use another strategy and still be able to see you in a way. Okay. All right. I can see you another monitor. That's not bad.
Okay.
Something. Yeah.
Okay. Okay, that's fine. That's
Okay.
fine. All right. Right. So um I've gotten a couple of questions. I think today we'll be doing answering questions,
Okay.
addressing
Yeah.
their concerns. And if there is anything you want to teach us before we start addressing the concerns, then because I think last week you did most of the teaching, that this is basically just us recapping on what you taught us. So can you hear me?
Okay.
Please,
Can
can
you
you hear
hear
me?
me? Yes, I can hear you.
Okay, let's start. Let's say a short prayer. Father, thank you for the opportunity to learn. We plead your mercies that you help us to understand in Jesus' name. Amen.
Amen.
So, a recap. Can you tell us briefly, in summary, what fibroid is? What um, just something brief on fibroids, and then I'll bring the questions. And then our area you
Yeah, but
think we need more education on.
before that, how are you doing? How is
I'm
your
fine.
health?
I'm fine.
We thank God. We thank God. We
I'm,
thank God.
I'm fine.
I pray and I wish you a very speedy recovery.
Thank
Okay.
you very much.
May God grant, may God grant you the strength you need and the healing
Amen. Nurses and doctors are such terrible patients.
Why do
I
you say
tell you,
so?
because you have an idea what is happening to you, and you know what is happening to you. You see that your thoughts will go to like, hey, so this can cause this, this can happen to me,
Yeah,
this
yeah,
can happen
yeah,
to me. So
yeah,
because you have knowledge on
yeah,
what is happening, so nurses and
yeah.
doctors are
Yeah.
terrible. We are
It's
terrible
just like
patients. We are
I
terrible,
agree.
very
It's
terrible
just like
patients.
if you're a doctor and your wife is pregnant, you begin to think, what if this doesn't add up? What if this doesn't add up? And then you should me. I mean, it's crazy. It's crazy.
I know. We are
uh,
terrible patients. But thank you for
yes,
joining
yes.
us. Our views
Uh,
are going up bit by bit. People are really interested in said fibroids. And then I also realized that doctor people are there are lots of questions in my inbox about ovarian cyst, about in
mm,
fact yeah, because about fertility. So maybe after this, schedule a time with us since you are a specialist in fertility and all the issues that had to do with. And then
yes, yeah, I
the
mean,
the cypro banking, the egg banking I mentioned earlier, people were in my inbox to ask questions because they didn't even know it could be done in Ghana.
oh,
You guys
oh,
are
I
not
see.
advertising. No, you are not advertising. You are not. You see, people don't even know that we are Ghanaians are advanced. We can do some things.
The truth is that per the requirement by the necessary regulatory body, health facilities are regulated how you can advertise. So
Oh,
you, are,
yes.
you
Yes,
have to
I've
monitor
heard
your
about
time.
the
Mm.
issue for another. The last time a doctor friend was telling me about when I went to his, I said we can't. I said, how? And forgive me, but some of these, in quotes, quack people have big billboards.
Yes, yes, the herbal, because their regulation is not as tight as ours.
Hey,
And there's one thing about Ghana. So we now say, "Nya, we need some now."
exactly. When you
We don't
some blue
have
coat and
time.
elbows and
So,
brow. Hey,
yes, yes, they are going to spell out all the details for you. So honestly, if you're a third facility and you want to advertise, you have to be very cautious so that you don't have issues with the regulatory bodies. It's very important.
we get
So
you.
not that, yeah. So we would like to advertise it, but we are very limited as to what we can do and what we can't do. And I'm hoping that a time will come, there will be some level of regulation to regulate the whole um, system for us. Yeah,
Hopefully,
yeah.
because it's giving opportunity for the quacks to be able to advertise and get people to go there. And then when the condition gets worse, then they do not, oh, there is this doctor here who could have helped, or there is this doctor
So,
there. So hopefully in the future, oh, I lost him. Eh? Oh, I lost him. I'm waiting for him to come back. Then we can continue. Oh, doctor, what happened to your something is wrong with his mm, I don't know. I think he went offline. I'm unable to. Please bear with me and bear with him as well. It's been a long day for the both of us. So. Okay, let me see if I've sent another invite. If oh jeez. Don't come to my room. Okay, I'm calling him to find out why. Ah, you guys have to forgive me. Oh. I'm doing the live video for my Pasha, you went offline. Oh. Okay. Okay. Okay, sure. I'm sending it again. Okay. Okay, here he is. Oh, oh. Yes, doctor, you are back.
I'm here. I'm here.
Welcome.
Thank you.
Okay, so please, the floor is yours. Tell us, talk to us. Yeah.
hope you can let me.
Sorry, can you say that again? Hello.
Hello, I can hear you.
Okay, so please take over. The
Okay, all
floor,
right.
the floor is yours. Yes.
Yes. So first of all, I want to use this opportunity to thank Wendy for the wonderful work that she's doing. She's a very fantastic lady. I'm following her. I mean, she's doing a great work, and
Thank
God bless you so much and give you the
you.
strength
Amen,
that you need.
doctor. Thank you.
Yes,
Thank you
and
so
I
much.
pray for divine health for you, sir.
Amen.
No health tsunami Gambia will come into your life, okay?
Amen. Oh,
Because
amen.
because we need you now than ever. So yes, so I mean, so in regards to our discussion last week, first of all, the attendance was great, and I realized that the information was also stand very deep. And the beauty about this whole issue is that we were able to reach out to people to answer one or two questions on the hearts of people. On top of that, a few people came to the facility who needed medical attention urgently. And as I promised you, Wendy and the team, all those people that came here, we've planned with them to schedule with them alone. We are going to give you 50% discount of our medical procedure.
I'm giving you two for that.
Yes, thank you. Thank you. So whenever they come and then they mention you, like, hey, I'm giving Wendy a promise. I take a picture with them. I take them through the picture. I say, look, I'm giving Wendy a promise. So I promise you, I'm going to take, how they call it, 50% of the, how they call it, of the procedure. Should be told when we come to the public sector, how they call it, fiber surgery, depending on the site, is done between 10,000 and 15,000. Okay, that is what the private
Yeah,
sector normally
yeah,
pays for
yeah. The
fiber
last time
surgery.
I asked on the platform how much people were charged for their fiber surgeries, there's one I won't even mention here. I'll send it to you privately. Because she didn't even post it on my page. She sent it to me in my inbox. And the amount, I was like,
Okay.
what?
Yeah. And truth be told that even when you have 15,000, whatever, by the time you are done, the miscellaneous expenditure, buy this, bed, everything, you end up going extra amounts. Okay. But I've given you my word. Whenever they can say, look, I'm giving you
Thank you.
great car 50%, and so far,
Thank you.
so good. So, and this promotion is for this month, and then to the end of the month, and maybe the first week of next month. Yeah. So I mean,
We have
once
to
again, all
close
this.
it before you get what you get. More than the number and you.
Uh,
Or
oh
you get
yeah. So
more than the 100.
yes. Anyway, yes. So I mean, so those who are interested, please, you can quickly get our number, contact Wendy, and then get our contacts. Got to get our
Please
number.
say the
I'll
number
put our
again.
number.
Say the number before you start and then repeat it when you are done.
Okay. So let me quickly get it. I don't have the number of her. Okay.
It's okay.
All right.
We
All right.
we
I will.
understand.
I will. I'll get it. I'll let my secretary actually bring it to me, and I'll
I have
actually
it.
put it online.
Don't worry. If you are unable to call, I'll call it out for them.
Please call it out. Please call it out. Not my personal line, though. The company
Oh no,
line.
no, not
Call
your
it out.
personal one. I have it here.
Okay. Call it out. Then we did. Yeah. If you don't mind, call it out.
No. Not your personal number. I have the number. I wrote it down there last time. So that's
Okay.
so
Okay.
it's 05030655558. 05030655558. And then 0302856781. 0302856781. I will post it on the page as well after the live so that anyone that wants it will be able
Okay.
to.
All right. That's good. So coming back to business, let me just give a recap of what we discussed. Last week we made mention about what fibroid is about. We spoke about what are some of the causes of fibroid and what are some of the risk factors of fibroid. Now, one of the definition we gave for fibroid is that in layman term, it's a kind of growth, okay, in the womb, that is the uterus, which is not cancerous. Simple as that. It's a kind of growth in the womb that is not cancerous. Because some growth can be cancerous, but fibroid, no matter how big it is, nature has made it that it's not cancer. But however, it can lead to cancer in rare cases, but it hardly happens. And then in summary, we spoke about some of the causes of uh, fibroid. And I remember saying that we do not know the exact cause of fibroid. Okay, most of the causes of fibroid we do not know. However, we know very well that depending on the family background that you are coming from, you are prone. to be infected with. You are prone to develop fibroid. Example, if your mother have a fibroid or your auntie have a fibroid, there's a possibility that you can also, have a fibroid as you are growing up. And we also realize that there are genetic alteration, genetic alteration, or what we call genetic mutations, in simple things, genes are things that determine how the human body should develop and how you should look like, the eye of your color, your height, and all those things. It's a genetic coding. It's the genes. Okay. Now these genes determine how your uterus will also develop and grow. If by any incident, I don't want to mention genes today because last week I mentioned specific genes, and I realized that I was told I'll be too technical. So let's put the name of the genes aside. Let me just put it
Yeah.
this way. There's some kind of genes in the uterus when they begin to overreact or underreact, it can lead to some level of growth of the fiber. And also, the fact that you're a black lady, means that you can easily get blood. That is that of course the before you're black, because statistically, blacks get fibroid more than our white counterparts. So the fact that we are white, you can easily get fibroid. So that's the summary. We also spoke about the risk factors that, what are some of the causes that make somebody prone for to fibroid? And we made mention about the heredity, as we said earlier on, the race, the race which we said earlier on. And we also spoke about nulliparous and obesity. Nulliparous simply means that a woman who has not given birth before and then who is obese. If you're not giving birth before and you are obese, there's a high possibility that you can also have issues of fibroid. Okay. We summarized it by also saying that we have different kind of fibroid, and I remember that we divided the uterus into three layers. I said we have the outside layer, the middle layer, and the inner layer. And I remember telling you that when the fibroid is on the outside layer, there's a name for it like subserosal. When the fibroid is in the inner layer, there's a name for it like intramural fibroid. When the fibroid is in the inner layer, the real inner layer, which was submucosa, we spoke about that. I remember talking about a rare kind of fibroid which can also grow around the cervix. The fibroid will grow around the cervix. Now, the cervix is the let me see the mouth of the womb. Okay, the mouth of the womb where your menses come out of, where the baby come out of from the womb. It's called what we call the cervix. Fibroid can also develop from there, and it also have its own name. Another one we also spoke about the pediculated fibroid. Pediculated fibroid is a situation where the fibroid is connected to a long thread, and the pediculated. Okay, that is pediculated. It's also we also have that kind of
More
fibroid
like
that uh,
it's dangling, like it's just like
pendulum.
you've held a balloon to a thread and then it's just dangling.
Beautiful. You're such a good teacher, you know. Yeah, so it's dangling. That is it's dangling. Okay, so it's kind of dangling. That's what we call the pediculated fiber. We say that fiber can metamorphosize. In other words, fiber can change over time. When the fiber goes to some level, the blood supply to the fiber, one way or other, can be cut short by raising investment to the system. And when that happens, the blood supply to the fiber will be cut short. When that happens, your fiber can become degenerated, and that is what we call degenerative fiber. Okay, the fiber is degenerating. Okay, or it's being rotten, quote unquote, it's being rotten. Okay, degenerating. If that happens, the fiber wouldn't vanish, okay, but it can give you serious complications like severe bleeding and co. However, when that happens over time, the calcium is formed around the fibroid, which we call calcified fibroid. Okay, they become very hard and firm. At this level, most ladies can easily even feel it from their abdomen. They put their hand on their abdomen and they can feel that there's something very, 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 very there's something, there's a mass, there's a solid substance in their abdomen, and that's also can also pediculated, how they call it, calcified fibroid. One other thing that degenerated fibroids also get infected as well. We will not go too much into that. And then lastly, we spoke about what are some of the things that will make you know that you have fibroid. And I remember saying that now most people can walk around, about 75 of ladies can walk around without knowing that they have fibroid. They have no idea that they have fibroid. Why? They don't have any symptoms at all. Okay, so 75 of people are asymptomatic that they have fibroid. That's why it's important that routinely everybody should be having a thorough medical checkup. It's very, very important. If you want to have a thorough medical checkup, you can contact us, you can get a thorough medical checkup to rule out if you have fibroid or not. We can do that for you. And also, people who have symptoms, one of the symptoms they can have is menstrual disorders. Okay, when we talk about menstrual disorders, it can be what we call hemorrhagia. Hemorrhagia, which means that you can bleed a lot. I know people who can bleed continuously for 30 days. It's like their life is a routine bleeding. Their life is routine bleeding. Or the short period in their menses, they can bleed continuously for 30 days. Very heavy flow. And some of them will say that they no more even use menstrual pad again. They use diapers and other things. So that they can soak their blood because the blood is very heavy. That is one of the causes of fibroid. And some people too, they have what we call dysmenorrhea. You can have severe menstrual cramps as a result of a fibroid, okay? And also irregular menstrual period. The menses will come today, it will not come today, it will come another time. And 30% of ladies with fibroid have issues with what? Infertility. And I want to emphasize that the fact that you have fibroid and you cannot conceive does not mean that the fibroid is the cause. Okay, that's what you must know. However, fibroid has been known that in 30% of ladies, it has been able to cause infertility in ladies. You have to see your gynecologist or specialist to really advise you accordingly. And another symptom you can also get is abdominal swelling, and also some people feel pains on the leg. Ladies can get pains on the leg. I mean, it's another sign of fibroid. A ladies who fibroid is very, very huge, okay? And the fibroid is sitting on the bladder, okay? You can realize you are urinating frequently, bacterial condition, because the fibroid is sitting on the bladder. Now, urinating frequently can be a sign of urinary tract infection, paranephritis, and what have you. So it is important that you are able to actually how do you call it seek medical advice if you are urinating frequently to be sure that indeed this is really fibroid or not. So in summary, this is some of the things that we spoke about at that time. All right, let's talk about diagnosis quickly and then diagnosis. Let's summarize the diagnosis. Yeah, so when it comes to diagnosis, we can do pelvic the diagnosis, we can do transvaginal scan, hysteroscopy, and all these scans to actually talk about, I mean, the cause. Whether you have fibroid or not. Treatment options are available. You can watch our previous videos and you can discover some of the treatment options that are available. However, one of the classical treatment options we have available is surgery. Okay, and surgery is so safe. We do surgery there for the gynecology, the child specialist, they do surgery all the time, and there's no problem at all. And as you are saying, those who want to opt for surgery for their fibroid issue, we are giving you 50% discount flat. 50% discount flat. You can contact us through Wendy. Our number will be on board. When you come over, we'll do the surgery for you. So that is a recap of what happened yesterday, Wendy.
Thank you very much, Doctor.
You
The
are
number
welcome.
of questions you have here, there.
Yeah.
Some are even in my inbox. So the first question that someone asked, I
Mhm.
actually I want us to just go by their questions. So no, however they ask it, I also present it to you. First question: can fibroids cause multiple miscarriages?
Yes, very, very yes. Why? Fibroid can cause multiple miscarriages. The why is because um, fibroid can sometimes lead to hormonal imbalance. Okay, and once there's hormonal imbalance, it can affect the ability of the pregnancy to be well growth, to well firmly attached to to the uterus, so it can cause miscarriage. Fibroid can also lead to distortion of the walls of the uterus. Okay, it's because I don't know. Wendy post a picture of fibroid, a fibroid. Okay, if you look at that fibroid that Wendy posted, you like that it is a mess. Okay, it's irregular structure. Okay, so imagine that irregular structure in the inner layer of your womb. It will be difficult for the baby to be well attached to the walls of the uterus. So once again, fibroid can cause multiple how they call it miscarriage. Also, fibroid can cause scarring of the uterus. Okay, therefore, fibroid can cause multiple miscarriage. However, we don't have to conclude that because you have fibroid and this miscarriage, the cause of the miscarriage is as a result of the fibroid. You have to see a specialist to be sure that it is indeed a fibroid that is causing miscarriage. Because we have other factors that can lead to multiple recurrent miscarriage. Thank
All
you.
right, doctor, thank you. Emphasis on the scarring. So are you saying that the fibers can scar the uterus? So it's just like you see that scars that, let's say after surgery or
Mhm,
however it is,
mhm.
you see the scars that we get on our skin. So we
Yeah,
get the same scars in our uterus.
exactly.
So you're
Exactly.
saying that once that happens a lot, like maybe multiple places in your uterus, when you get pregnant, it will be difficult for implantation to take place.
It can be difficult. It
It
can be
can,
difficult. It
yes.
it can, yeah. It's not a definite sentence. Why am I saying that? People have fibroid and successfully they've carried pregnancy to term. Okay, that's why I use the word it can. It can, which is very important. So we have to actually look at that. The issue is that the baby grow, we need a very well shaped lining, okay, to be attached to the mother, to the placenta, to grow. Okay, if there's scarring of the uterus or there is a distortion of the uterine cavity, I mean, it's difficult for attachment, and that
Okay.
alone can interfere with implantation and then the placenta being well attached to the walls of the uterus. So yes, of course, fibroid can cause multiple miscarriage,
All
and
right.
also fibroid can impede the flow of blood, okay, to the baby.
Yeah.
Why? The fibroid is competing with the blood, okay. Fibroid, they are vampires, oh.
Yeah,
They are like vampires,
yeah,
okay.
yeah. You said that
They are like
last week.
vampires. They are like vampires. So they are competing, okay, and because they are well structured, they've been well established in the walls of the uterus. What it therefore actually means is that if care is not taken, the necessary blood flow to the baby may be curtailed or be reduced. And if blood flow to the baby is reduced, it means that there'll be less oxygen to the baby, there'll be less nutrient to the baby. Therefore, the body will expel it so that the baby will be safe. One way or to protect the mother as well. So these are some of the issues.
Thank you, doctor.
Welcome.
We are getting very practical, so I'm sure people will
Yes.
be happy. So one person, she asked about 6 questions. Blessed Shika, you have to pay me after this, because there's plenty questions there. Okay, so her first question, she said that are there herbs or supplements that can that we can take to prevent new fibers from growing? I know you said something last week, but you have to repeat it.
Yes. So of course, we can give you some level of supplements, okay, natural supplements, which we believe that can help the body to prevent fibroid. Which we believe, I use the word believe because we don't have any factual evidence. Okay, why am I saying that? If you follow our discussion last week, when we spoke about the causes of fibroid, is beyond supplement matter. Some of them are genetic, some of them are racial. Example, you are black. No matter what you eat, you are black. And then the possibility of you getting fibroid it's real, you know. So, however, there are some level of supplements that have been named and noted that it can help to prevent fibroid. Now, when it comes to herbs, I can't talk about herbs because I have no education on herbs, I have no knowledge on herbs. So I can't say that there's herbs that can prevent fibroid. Of course, there's a lot of less allegation, a lot of speculation out there that herbs can help people to even cure fibroid. Okay. However, I don't believe in those things because there's no scientific evidence attached to it. Okay. Now, when it comes to supplements, B or omega-3 fatty acid, okay, for instance, I've known that, okay, because it can regulate estrogen, I mean, it can have a way to help the reduction of I mean, fibroid. Green tea, for instance, contain antioxidant, and because it can contain antioxidant, it can slow down fibroid growth. Vitamin D, for instance, has been linked to some level of fibroid growth. These are all, they are just research
There's
going on.
no
Okay,
there's
there's
no
no
real science
there's
saying that, oh, this can
scientific,
do this.
this can be. Thank you very much. Thank
So
you very much. There's no
basically, these
thing
are
that this
just
can
like
do.
supplements that would help boost your immunity in a way,
Exactly.
so that
So
I mean, but it's not factual. It's not like
beautiful.
exact.
So this is the catch. If you belong to the higher class and the middle class, why doing the supplements? Because most definitely, you eat salmon, you are getting omega-3. Do you understand me? So,
Yeah.
because a balanced diet have all the nutrients you need, especially if you're in the middle age. Why do you need supplements? Why don't you eat healthy? If you eat healthy, you have all the necessary supplements because most of the supplements out there, the question you have to ask that, are they 100%? Are
Even the
they,
source,
are
the source of the
they sure?
supplements,
You
the
have no
the mood of
idea.
even most of them are not even made in our country. How they are even transported? Because some even say that keep away from sunlight, do this, store here. How was it stored before it got to you? How was it transported? Is the potency still
Oh,
intact?
mhm. So
It's
eat healthy. Simple as that. Eat healthy, eat balanced diet. Okay, balanced diet is balanced diet. It covers all areas. Okay, because once you live your life depend on supplements, you may end up introduce inorganic substances into your body because some of these supplements have preservatives, and most of these preservatives are inorganic. Okay, so why do you have to hurt yourself? So I believe that it is very important that I mean when you're in your middle age, you rely on natural food, and I think you get all the supplement that you need. Another thing that we can also look about is I mean um, avoiding weight loss, okay? Because there's this linkage between weight loss, nulliparous obesity, as I explained earlier on, some of not giving birth, and obese to fibroid, okay? And we are not saying obesity causes fibroid, but we have realized that when you are obese, there's high level that possibility that you can actually get fibroid. For that matter, we actually advise that if you can control your weight, it's good. In any case, weight control is not only good for fibroid, it is also very good for how they call it uh,
your entire
cardiac
well-being.
activity. The
Yeah.
entire well-being, the entire well-being. So weight loss is important. Regular exercise is important. Avoid unnecessary alcohol intake. Unnecessary alcohol
Hammer
intake.
that
Stay
area.
hydrated.
Hammer that area. Hammer that area.
And
add
I think
add add
unnecessary
the fizzy drinks. The You can't mention names, but
carbonated,
add those one exactly. The one that you open and do
carbonated.
like those ones. Add them.
So I mean, so you see, for me, there's something that I say all the time that I think I'm sure our forefathers may not be getting the fibrobula that we are getting because there's high possibility that as at that time there was healthy life, healthy eating. Okay, so health is also important for good food, good health. Simple as that. Good food, good health. Exercise, and you are good to go. Now, let me talk about exercise briefly. I believe that the human nature, from our genetic and biological background, we are wild, okay? We are made to go out to hunt. we are made to work a long time to look for shelter. Do you understand? Naturally, that is how our makeup is. So now that we are living our comfort, some people can the whole week they've not worked because from their car to their office, from their office to their car to their bedroom. Okay, it's imperative that we will exercise. Okay, because that is how our body actually lives and exists. And we have to do that for good health. Yes. Okay, next question. Yeah.
All right, doctor. So you answered my next question because she was asking about lifestyle modifications, but you've answered. But she's
Okay.
asking a question. I feel like that question, and the Ebemaya, it will take more me how I'm missing explaining because it would be like we are introducing something new. She's asking that kindly tell us more about high AMH and how to control it. I don't know how you control AMH.
Ah,
That's so I
okay.
was hoping we could
This is a
maybe.
different topic. This is a different topic about fertility.
Yes. So I was hoping
Because
that I would tell them so that we could push it to like when we are tackling fertility. Because this will require you to, it would take the
you,
essence of the
yeah,
fibers that we are trying to
yeah, yeah,
discuss.
yeah. So let me just recap. Someone will ask, what is AMH? AMH simply means anti-malarial hormone. Okay, it is a hormone that helps doctors to determine the ovarian reserve. Okay, as a lady you are growing, the hormones pick up to some level. As you go to some level, it decreases, and it gives doctors an idea to know what is the level of the reserve of the ovaries that you have. That's and this related to fertility. So I think with the schedule of Wendy, we'll be treating fertility on our next topic, and then maybe this question we will answer it for you. Thank you very much.
Doctor, the schedule is you. When you are free, then we do it. Me, I'm here.
All right, we can do it next week. I'm available. I'm
Okay, thank
available.
you.
So
Thank you very much. Because a lot
we
of
can
people
do
are
the
really
fertility
concerned
next
about
week.
fertility. So if you are
Yes,
tackling
yes,
fertility next week, I'm sure they'll be
yes,
very,
yes,
very
yes,
happy.
yes. Exactly. We
So
can
her
do
next
fertility.
question: what advice will you give to someone who has had myomectomy and CS? No, the question
Wow.
is not. I think she's asking that if it's safe to have another pregnancy if you've had a myomectomy and CS, and she's also asking how many years you have to wait in between. I mean, I think is basically where years between maybe pregnancies, and also she's asking if you can if you've had a myomectomy and CS, is it safe to have another pregnancy? That's a question.
Wow. This question, to be honest, is not a straight jacket question answer because it will depend on a lot of factors. Okay, which I think that you will have to discuss thoroughly with your gynecologist and then come out with. But then let me give you a general answer. Okay, a general answer and then that of a general overview. Now, when we talk about myectomy first, someone asked what is myectomy? Myectomy means that simply removing the fibroid. Okay, that's what we call myectomy. Someone asked that what is CS? CS simply means that delivery through surgery. Okay, when they cut you, they take the child out. That's what we call CS, C-section. Okay, so all right. So the appropriate age that is required for a delivery for someone who have done myomectomy and CS should be between 12 to 18 months. 12 to 18 months. Hopefully by then the scar would have been thoroughly healed. Okay. And but then it's important that maybe after 12 months, you can see your doctor, then we can do specific kind of scan, MRI or scan to monitor the scar, okay, to give you a go ahead to get pregnant or not. But ideally, by 12 months to 18 years, 18 months, 12 months is 1 year, okay? By 1 year to 18 months, you should be able to, give birth again. However, when you get pregnant, you have to speak with your gynae and consider maybe just go for CS and not vaginal delivery, okay, for the purpose of safety. Yeah.
All right, thank you, doctor. This next question, I know it's of concern to a lot of women. Well, let's say I want to learn more so that I will know if what I have in my head is right. She's asking that why do fibers recur? I think you tackled this briefly last week. Why do fibers recur after surgery? Any tips to avoid this from recurring? I remember you talked about the genes, the fact that you
Yeah,
took away the
yeah,
fibroid as if the genes are no more
yeah,
there.
yeah, yeah,
Yeah, I
yes.
remember.
So this question, I know some people probably have the notion that fibroid will occur because the doctor who did the surgery is not good. No, that is not it. Okay, fibroid can easily recur because it has to recur. Anyway, so
Because fibroid is a vampire.
yeah. So here's the catch. Okay, as I said, we don't know the exact cause of fibroid. Okay, we only have some level of risk factors and possible causes. Okay, so if that is the case, then it therefore means that taking away the fibroid itself is not really a treatment. We call it symptomatic treatment. Symptomatic treatment. Okay, it's not dealing with the underlying cause. What led the fibroid to be there?
It's
Okay,
still there.
so example, it's still there. If you have your fibroid because you're a black lady, the fact of taking the fibroid away doesn't mean that you are no more a black lady. Okay, it's very important. Or if the
Still
cause
black.
of the fibroid, not so black, if the cause of the fibroid is as a result of the fact that there may be some level of genetic mutation, okay, if that is so, taking the fibroid out does not mean that that genetic mutation is not there. That genetic mutation is there. Okay, so um, depending on other factors, genetic factors, and social factors, after successfully done your fibroid, the fibroid may reoccur. I said may because not all fibroid reoccur after surgery. Some people they do their surgery and it's done no reoccurrence. However, we have some people that after they are done with the surgery, by 6 months, 7 months, every two or 3 years time, the fibroid begin to grow. There's something I've also noted. You see, some of the fibroid, you see, I sent some pictures to when the kindly close them at the
I
right
posted
time.
one. I posted one today. They don't watch it. They're afraid. I posted.
Please post all the picture. Yes, there's this
I'm
family
posting
will
it
put with
right now.
yes. The photo can come in different shape, different size, and lots. There's one picture I sent you. It's in a very blue. It's like in a very blue container. For that, I remember in Battle Hospital. That was done there. We did it for the Catholic Hospital. It's in this container, and the family notice and we put it in the container. This kind of blue container, and look with different shape, different sizes. So the surgeon or gynae who is doing the fibroid we have to take time, remove all these fibroids one by one by one. Sometimes there are little one in the uterus that have not really shown up, so we cannot deal with them. Or they are too small that you wouldn't like to risk taking those ones out. Okay, so when you take out all the big one, the major ones out, when you close, when you done the surgery, over time, the little ones which are inconspicuous or cannot be seen or too small begin to now develop. Okay, so that is it about that. So fibroid surgery is important. You are supposed to do surgery, but I said you can easily, it can easily come again. That is why if you're a woman, you want a child, okay, after after you do your myectomy, by 1 year time, start preparing. After that, start preparing, get pregnant, and then you are good to go. Yeah.
That was someone's question, so I'm glad you mentioned this because she asked. Yes, she asked that why is it that when you have maybe sometimes when you have fibroid surgeries, the doctors will tell you that maybe after a couple of months or maybe a year, if you can maybe get intimate and have a baby, they would advise that you do that. So that was going to be my next question. That
Okay.
was what someone asked.
Okay.
Yeah.
Okay. That was great. That was great. And I think it's very important because doing that is important. Because once you get pregnant, and then, but given that once you get pregnant too, pregnancy has a way of reducing the effect of fibroid also. Okay. So getting pregnant is therapeutic. So if you have a guy, get pregnant, you can't get pregnant, contact us. If IUI you do, IVF you do, we will do it for you and then you'll be okay. Yes.
All right, doctor. Someone is asking a question. A bit of okay. Answer this, then you answer that one. Someone asked us, can fibroids be removed without open surgery? I think you mentioned this last week,
Yes,
but
fibroid can be removed with an advanced technology we call laparoscopy. Okay, laparoscopy simply means that we are not going to cut you this way. Okay, a hole will punch on the left or the right side of the abdomen, and then the camera will be sent it down. And when the camera is sent there, we use the camera to determine where the fibroid is, and then we take it out. Okay, that's an advanced form of healthcare. And that kind of surgery, the same day you can walk in around. You take the fibroid out, the second day, laparoscopy, it can be done. We are talking about. However, it is very expensive, very very expensive.
hammer that,
Okay, those
hammer
who
that one,
yeah,
hammer that
so
one.
for the use for laparoscopy 50,000 in most parts at least because laparoscopy most of it in Ghana the government sector. I don't want to mention some names, but I know top government sectors who are now trying to use implement laparoscopy into their system. Top teaching hospitals, I don't even have laparoscopy set up now. Okay, they are now trying to bring the laparoscopy. Okay, I know a few health facilities who have laparoscopy in the private sector. We currently have our laparoscopy department, which is actually being set up. But the truth is that laparoscopy surgery is very expensive, very expensive. 30,000, 40,000 is probably done.
Doctor, but question, the program that is coming up as Kratos, your facility, is there a possibility if someone wants like someone doesn't want an open surgery,
Yes, so
and then her type of fibroids permits it, and the person can afford it?
yes,
Is it possible
it
at
will
your
be
facility?
done for them by the by the foreign doctors who will be here on the program.
I wanted
That
you
was
to hammer that people can access that kind of treatment,
yes,
the upcoming program, if you can afford it, and that is the option that you
ex-
want. It's accessible.
exactly.
Yeah.
It's affected. That's what I said earlier now. It is being set up. The gadgets are being set up, and
Oh, they are in.
yeah, the gadgets are
Oh
in,
wow.
yes, and then we are setting up,
I
and
have to
that kind
come. I
of
have to
schedule.
come. I have to come and
I'm
see
waiting
next
for
week.
you.
Oh
I'm
no, no,
waiting
next
for
week I'll
you.
come to Accra. Next week I'll come to
I'm waiting
Accra.
for
I have to
you.
come. Yes, I have to come and see it.
I'm waiting for you, okay?
I'll come. I'll
And
come.
that's service will be done by the foreign trained doctors from
Yeah.
Spain, Bangladesh, and India who actually does it. So those who can afford it, we can just opt for that. It will be done for you. And the beauty about that is that one, minimal invasive, okay? You work up, you go, less pain, less discomfort. You can resume your normal life so easily. It's there, okay? It can still be done, okay? Yeah. So those who opt for that can afford it, the door is open, you can always do it. Yeah.
All right, doctor. Thank you. And when you were talking, you said that when you sent me the fibers, the one in the bucket, and how the number of noodles in it, people. How might let them know that it can take hours to even perform? Sometimes a fiber surgery can take like it can take hours. Like you said, sometimes you said there are a lot, and you have to take your time in like taking them out, so that people will appreciate that this 50% you are giving us. You are not even saying that, oh, it depends on your type of fibroid, but you are still giving us 50%. But let them know that sometimes a lot of hours, a lot of expertise goes into the surgery itself.
Yeah. That is so normally. Someone will be like, hey, how come we all went to the same hospital? Someone we did the same fiber, someone was sad higher, someone was sad less. Because not all fiber surgery is the same.
I wanted you
Some people,
to hammer that because
their method
some
is so
excuse
huge.
me, but if someone spends 6 hours to get you operated on, and even spends 2 hours to get another person in quote, the cost shouldn't be the same
Yes,
because the
it's
person stood for 6 hours.
and the surface use. You are going to use more
That is
God,
what I was
more
going to
oxygen,
say.
more medicine.
That is
It's not the
so.
same. Yes.
Even with us, if we come and then there's a slight difference in the prices, people should understand and bear with us.
Yes.
because not all the fibers are the same. That's why I'm
Not
saying that
all.
talk about it. Right now, you've been at 50%. You've not spoken about what type of fiber, but just let them know that sometimes the fibroid can take, like the 6 hours that we are spending on you, could have spent it maybe on 3 different patients, but you are
Two
taking
different
six
things.
hours. Exactly. So
Exactly.
if you come and then you
Exactly.
say that, oh, this person paid 500 cedis, but you are paying maybe 800 or 900, then you should know that it's not the same.
It's not the same. Let me give you an example. One of your clients came here this I'm not mentioning name, okay?
Yeah, I
And
know.
her
Even me,
fibroid
if
is
I ask you
like,
her name, you will not tell me because
no,
I know
not
you
at
say
all.
confidentiality. So
Privacy,
me too, I won't ask.
yes,
Me too,
yes.
I won't ask.
Privacy is very important, unless the first one to talk about it. Yeah. Her fibroid is almost like a 9 years old baby.
What?
Imagine about three, okay, about three calcified,
What?
okay, about three calcified. Yeah. Thank you. And according to she's having about 18 years now. Okay, calcified of the
What?
marriage. Thank you. Okay, and when we did a scan, we could identify three huge fibroid. Okay, it's so scary. You really think like a child. Okay, it's so scary. They think you're a child. And I was telling her that this is what the scan can see. When you go in, you realize that there'll be more hidden somewhere that have not been seen. Okay, so such a person, you would expect that we have to charge her quite high. Okay, but her to say that because the promise we have already, we also do it for her at a very subsidized rate. And she's
Thank you.
very grateful. And we are
Thank you.
preparing that
Thank you.
next week. By next week, Tuesday, Wednesday, the procedure will actually be done for her.
You know, such a person when she comes out would then become like a walking main kind of saying. She would be telling people because the other day someone was wanted even to come on the live video. Was his sister Wendy? I was walking and living like a ghost. Like me life, you know, basa. Nothing was working out. Nothing was, cause she another like. But when she got the fibroid, she realized that she got her life back together. And then one
Hmm.
other person came to me and said, I should have done the surgery a long time ago. I waited for too long. And now even after
Hmm.
the surgery, I'm not getting my life back together, but I'm unable to
Hmm.
work because it stayed with her for so long and she was doing, what you are trying to tell people not to do. I'm taking these concoctions, this kind of,
Hmm.
and at the end of the day, even gave her more, problems with her other organs because she was taking concoctions that she didn't even know the scientific what science goes into it.
And for some reason, they are told by these same people who give her power and don't give them that. Hey, who can send you out? Who to over? Who can send you out? I mean, that
Ahoɔden
is
mu
so,
akyɛ mmienu. Wɔn
yes,
yɛnya de sɛ kan sɛ Kim. Ahoɔden
yes.
mu akyɛ mi.
Hmm. Okay.
Ahoɔden mu akyɛ.
So, yeah, so honestly, so that alone makes people fear. And I realize there's a strategy some people use to extort money from people, okay, to come, we do what we do. And they know the medicine will never truly accept for you. And the thing I don't know, they give them that kind of medicine, they begin to, clot begin to come out from their vagina, and they believe that the clot is the fibroid. Okay,
That is, I don't know. Sometimes when they come and they say that, oh, and this thing came, I'm like, have you? That's why I've started showing people fibers.
yes,
So that when you
so
see
here's
that
the
clots are
picture.
coming out, you don't mistake clots for fibers. Clots
Clot
are
are
not
fibroid.
fibers.
What about fibroid? If you're going to make a concussion meeting, they will say, oh, it did PA. It's not fibroid, okay? It's not fibroid. So,
Now,
if
if
it is,
fiber
it
comes
is
out,
fibroid.
fiber like this ball like comes out of your vagina, you will run. Oh. Because if that thing hits, it will bounce. Because if that thing, it will bounce. You will run because it's like I have to say, I don't know, meat that's covered in like kind of super glue, like something.
I,
It
I,
comes out, you will run.
you know what we do? At one of these days, we'll make our way that the course one of our surgeries, we will invite you, you take the videos and the picture, and you show it to your people.
That
Then
will
you understand how the
work.
fibroid is likely. So when they see how the fibroid just tell you that, hey, I mean, I can give you medicine to expel that out. How
Yeah,
you going to expel that thing out? How
yeah.
you going to
That will
expel
be
that thing
perfect.
out?
Yeah.
You know the anatomy of the uterus. How you going to expel it out with your
That's the
medicine?
whole point. Do they even know the anatomy of the issues? That's the whole point, to be honest. So, doctor, someone is asking, is there a linkage between high BP and fibroids, or it's just a myth?
Not really, not really. It's not true. There's no linkage between BP and fibroid. Okay, unless probably for some you already have your blood pressure already, fibroid after setting. There's no necessarily a linkage between it. Yeah.
All right. All right, doctor. Thank you. Someone is also asking that she has had her family, her auntie had fibroids, and then I think around the age of 40 something, maybe 45, 46, and she went to the doctor, and the doctor is saying her menses were not coming like regular, and she thought it was a fibroid. So the doctor was saying, "Oh, you are nearing menopause, there is no need to operate you for the fibroid if it's not causing any life-threatening symptoms, because after menopause the fibroid, it will probably shrink, or it will probably just go away." So the person is asking why that advice? Why did the doctor say that to their auntie? Why?
Yes, first of all, before any doctor catch a fibroid, the question we ask is that one, is the fibroid affecting the quality of your life? Or the fibroid preventing fertility? If you're a young woman or elder woman and the fibroid is so affecting the quality of your life, you are not having unnecessary bleeding, dysmenorrhea, and all those symptoms we spoke about earlier on. You don't have issue with fertility. Okay, why should we touch it? Why should we touch it? Okay, because mind you, when we move it, it can regrow. Okay, it can regrow again. So if it's necessary, don't touch it. However, if you are close to your menopause too, the fact that the hormonal issue can help with the shrinking of fibroid. That does also mean that people who are with menopause do not have fibroid. They can be in menopause, they can still have issues with fibroid. So it's not one fits all.
Okay.
It is a tail everybody and their issue. Now, the issue also about the fibroid and also the hypertension, very big question is that to some people, fibroid can increase the risk of hypertension. Okay,
Okay.
but fibroid do not cause hypertension. They are two
Okay.
different things. Okay, fibroid can increase the risk of hypertension, but the fibroid is not cause hypertension. Yeah. So yeah, so
Okay, doctor. Thank you. Thank you. I think there is some science in that. So thank you very much for. I don't want to take your
and,
time a lot today,
oh
because I know that
no,
you had a long day. So I don't
no,
I don't want to take all your time today. I mean, I think we've covered most parts of it. We've covered you've made, because you mentioned all these last week.
no.
People just needed clarity on it.
Yeah, but
So
let me answer this question. Someone just asked a question, and I think it's important we answer. Is it true that once a fibroid surgery is done and a person doesn't get pregnant, almost immediately then it means there will be a difficulty in getting pregnant? Wendy, did you hear that?
I did.
Where do you hear this kind of things from?
They hear it from the house. So he doctor, you
No,
see, they're home doctors, so they are
yeah,
home doctors,
yeah.
and you see that when some of these things are happening to you, you are so much looking for a solution that when someone says the slightest thing like, oh, this or that, then you see that our attention will go there, right?
Hmm,
Like,
hmm,
even that's why I want us to tackle fertility next week, because the type of fertility issues that come into my inbox and questions, you realize that, no, you see this thing
mhm,
logically, you shouldn't even consider this. I sat in a meeting when we had a stronger women's conference, and I always forget this lady's name, this lady that I admire so much. She was telling us, I think Miss V did, and then the other lady, they were telling us, the other lady, she was telling us about her fertility journey, doctor. And as well educated, as well enlightened, her position in society. And then she was telling
hmm,
us some of the things that she did
hmm.
because of fertility. I was sitting there, my just I was just my menu
Yeah,
be. So
yeah.
I was just telling myself that, it's easy for you to sit here and say that, oh, but you should have known better.
Hmm,
I haven't worked a mile in her
hmm,
shoes. And then
hmm,
she didn't get the correct, because the Emma Winipon, her mother literally dragged her to a doctor.
yeah,
Literally. And that was where her miracle even started.
hmm,
When but for years now, 1995 without getting seen by a proper doctor. So sometimes I feel like once they are looking for solutions, and Kofuki can't seem be an attorney, obi horse. Oh, me call you catch me say me yeah mean. Then she feels like okay, and then it brings some sort of pressure, and fear for and then some in quotes desperation to maybe find solution to our problems also, it counts, yeah.
And you see, when it comes to fertility, honestly, let me give this advice to our mothers, our in-laws, our brothers and sisters out there. The fact that someone married doesn't mean that the next year all over. Okay,
Yeah, Michelle,
marriage
I
is
want to say
not
God
all
bless you.
about marriage is not all about childbirth. You see, childbirth is an addition to marriage. Okay, so I mean, because sometimes the pressure, okay, from the family, from the society, even from the church, even from
From
the
the day
church.
that the marriage is being blessed, then they will go like, oh, yeah, I first say then right from there the pressure starts.
Some questions I don't like asking after marriage. After the whole ban, I don't like asking that question, okay, because you may end up asking a very sensitive question. Do you understand? Look, I know a couple, okay, who was precious to the extent that she had to have an affair with a brother in order to get pregnant.
Oh, there's an issue of
Yeah.
a father-in-law. It was discussed why I went to. It's not even a secret, so I can't even say so I'm sharing someone's story. So the man is unable to father a child. Apparently,
Mm-hmm.
there is no production of sperm, and then they've gone to do all the testing. They realize that the father-in-law is still
Mm-hmm.
capable of like he's still capable of uh, impregnating them. So they want to do IVF, but they want
Mm-hmm.
to use the sperm of the father-in-law. Can you imagine?
Yeah,
And
yes.
to fertilize the egg. And I think before the son was okay with this, and then after I think going through the process and everything, now the man is saying, I think it's either the man, one of them is saying no, and it was an issue. It was brother. This is something that someone is going through. So I'm not surprised that they will go. Imagine you having your husband's father is going to give you a child, so it's going to be your husband's. It's just messy, It's just so messy.
And I've explained this issue before. So it looks like these are very simple. And the in-law was telling me that this is the issue is that they know their son. Okay, that's the woman. The woman was telling me that's the mother-in-law. That's the boys, the man's mother. But then they know that their son cannot fertilize the woman because they got a lot of sperm. This shows that the man is pregnant. Which is previously means that there's no sperm production. Okay, we'll talk about that in our next discussion. So they were advising me that they were telling me that I should take the husband's sperm, that is the boys that this sperm, and give it to the woman without letting the woman to know that I'm giving her in-laws sperm.
She'll come back and see you.
You come back and see me.
She'll
And you
come
say it's a
back and
morality to
see
do
you.
that. What's the
She will see you and
morality?
she will win.
Yes, the morality.
She will
You
see
see,
you.
so sometimes, look, when you're now see people out of desperation can concoct things, eh? People out of desperation can try everything to do a lot of things. So I want to send this humble appeal to society. Stop giving young couples pressure. Stop giving them
Thank you.
pressure. The right time will come, it will come. If it does not come, it is still married. Allow them to enjoy their life. People can still live life without actually get it, giving them. Okay.
People
This
don't
doesn't mean that
want
they're
children.
forcing.
People don't want
Yes.
children. I had a professor. I had a professor in Canada, and I sat in her class for at the time she was 44. Her husband was also a professor at Waterloo in Canada. They said they don't want children.
Mhm.
They don't want children, and our class was just Africans, and like uh, you could see that some of the men were like surprised, like why don't you want children? We don't want children. We don't want children. So people genuinely are not even ready to have children yet. So
So Africa, Africa, we have to come to a point where, well, it's a blessing. If you don't have a child, if you have a child, too, it is a blessing. The absence of a child doesn't mean that there's no blessing in the marriage. Okay, There are more things that God will use if you are religious. God will use the marriage to do. A fruitfulness of a marriage is not dependent on the availability of a child or not. Okay, so just get what you have to do and do. That does also mean that you don't seek medical attention. Seek medical
Yeah.
attention. There's no shortcut. Going to some quote unquote spiritualists where we know that spiritualists we say, let me have sex with you and push them into you. But a lot. We've heard crazy things over here. Ladies are
Oh,
tempted to do
there's
crazy
this
things.
this lady story I'm talking about. She said she went to see one in court, man of God, and then like you are in line to see him, and then when you get to your time, you say that yes, you want a child. Okay, so the sperm that can give you a child is with me. And this lady was like, ah,
Mm,
my husband is
mm,
home and the sperm is with me, so how will I get the sperm? And then there
mm,
was commotion. Why are you asking questions? The sperm is with me. He said, for this sperm, I don't know how you get it. She said, genuinely, she
mm,
was confused. Like, how would you
mm,
give the sperm to my husband to give it to
mm,
me? Right?
mm,
So, unless you've been there, doctor, like you're saying, you can't
mm,
even judge
mm,
anyone.
mm. Yeah, so if I'm going through a lot of things, and society have made it so bitter experience if couples after 2, 3 years don't have a child. So all I'll tell couples out there is that listen to me. If you're having issues with fertility, first of all, don't succumb to any kind of external pressure, not even the pressure from your husband. Okay. The truth that if the child was there, you'll be happy. You know it. Amber is such a fault. Okay. So first of all, if you're religious, trust your God. Two, seek proper medical attention. And now, folks also have to bear in mind that the fact that you are seeking medical attention also does not guarantee that the child will come. You can even do the highest form of IVF. It is never 100%. Okay. So be open to all possibilities. Be open to possibilities of you receiving the child or you not receiving the child. In either case, you are more than a conqueror. Live your life, enjoy your life, and make the best out of your life. But don't succumb to any pressure. We are there. We can also help you on the fertility journey. Whatever you need a fertility journey, you can contact us. We'll help you. Next week, we'll also talk more about fertility to help clients who really need that facility. So to answer the question of Madam Owusu Nalina, yes, when you have fibroid, you can easily give them. Okay, the fact they have fibroid doesn't mean that you can give them. No, you can give them. It doesn't mean that you have to give birth immediately after fibroid. Other than that, you will not give birth at all. No, that's the wrong perception. After fibroid, you can give birth. Depending to after fibroid, you may not be able to give birth. So there's no straight jacket answer to that. Thank you.
Okay, doctor. So, okay, so a friend of mine has just inboxed me, someone I respect so much. So people
Okay.
don't like what we are doing. Or they are trying to report a video because we are indirectly they think we are yes on Wejuma. So I think by next week we will create we will use a YouTube channel. Um
Okay.
and then we will share the link on Facebook for people to watch, so that the videos would be there all the time. So anyone who wants references would be able to reference it, because we are, yeah, you see, that's what we were talking about too. We are trying to get the right information out there. People think that you are trying to, oh, say Omejuma. How
Ejima.
how how are you so
Is it?
inconsiderate that you don't care about the health of the other people? But
Mhm,
yes, say
mhm,
Wejima, because we are telling them
mhm,
this is the right information. You see,
mhm,
doctor, I have I don't know if I told you last week, the KNUST, the herbal trained doctors, their president. I told you, I don't know if I told you she reached out to me. I even spoke to her today. She wants me
mhm.
to put her on so that she would also be able to come and tell them that, hey, we are the educated herbal ones. We haven't advertised any drugs to say that this and this can melt fibroids. So don't listen to the quack ones. I mean, sick fibroids are is through surgery. Like you said, maybe some supplements to help you with the, the growth and stuff like. But there is no herbal as of now. She told me this herself on phone. As I now, there is no herbal medication that says that it can melt fibroids. I mean, she is trained 6 years in medical school, herbal six, and she's trained, and she's telling you that there is none like that that can melt fibroids. And then, excuse my bro for my French, but there's someone who has not been through this kind of training. Or say my ready bare 3 months, my call. I went into isolation for a couple of days, and then I got these revelations, and I have this and I have I have that, and and it's just it's bothersome. Like you don't even get it. Like, why? So I maybe what people will listen to her because she's a herbal doctor. Let her come and tell them that, say, go to doctor, go to Richard, go to him, let him operate on you when you have fibroids, because herbal concoction be any why they baben nane it doesn't happen. So maybe next week, maybe from next week, we will just do use a YouTube channel and share
Yes,
it.
someone just said, actually, someone just amplify my voice, so I'll have to amplify
Oh
my
no, I
voice.
think it was in the beginning. You are good. It's
Oh, okay,
because
okay.
I can hear
All
you
right.
very clear.
Okay. And someone just said something. She's, hey, Madam Usu Belina again. She said, God bless you, doctor. I am sitting down here with my mother listening. And she started lamenting, I am wasting my time. I should just get someone to impregnate me because time is going after my anatomy surgery. What do you say?
She really just said why this question. This question just said wow. But this one there, hey, mommy, take it easy on us. So take it easy on
Mommy,
us.
take it easy, take it easy, take it easy. Because, mommy, take it easy. The reason is that we are living in Africa, okay? And in Africa, we believe in the family setting. Someone should just impregnate her. Is it just anybody? So, do you want an irresponsible man to impregnate your daughter? You see, you can get a child, but some men can make your life a living hell. So, do you want your granddaughter or grandson, and then your daughter will be experiencing bitter life experience you don't know. Okay. If you're not careful, you will push your daughter into the arms of an opportunist or a man who is very cruel to women. Okay, and should be a victim. So, mom, please, rather add a yes to your daughter, and then trust that the training that you are giving to your daughter will be able to make the best decision to get the right man to impregnate her at the right time. So please, after mammectomy, that means they cannot get pregnant. You can get pregnant, okay? But if for any reason after mammectomy surgery the child is not coming, you can come to us. We'll investigate and see if that is causing a problem or not. So, mommy, please hold on for your daughter. What do you say? Add your voice
And
to
you
this
are
one. We can
open.
hear.
She should come and see you. She should come and see. If it's with fertility after the myomectomy, then she should come and see you. I mean,
Exactly.
there are a lot of options too, options. If
Exactly.
it's just the pregnancy she wants to get pregnant,
Yes.
there are lots of options. So she should come and see you.
Exactly. Yeah. I mean, yes, yes. They've had that option. There's the donor sperm, IUI, IVF.
Exactly what I'm saying. So she should come and see you. If it's about
Yeah.
just wanting to have a baby, then she should come and see you.
Okay. All
Okay,
right.
doctor.
That's
So
it.
yes. I'm just looking through their question. Someone is saying I should ask a question, but is it no, we've answered this. Please, how much is the laparoscopy for his team? Yeah, so like we said, it's expensive, between 30 to 40K. So if you can afford it, that one is expensive. That one you have to the brand new Yanka price didn't show. We were just giving a figure around that way, but yeah, someone is
Yeah. So,
saying no, doctor, go ahead. It's just
so
commentary.
as Madam Wendy is saying, it's a ring for the kind of laparoscopy. So you can come around, we will assess you, and we can give you the right. Yeah, like a crack. We can give you a better deal because of Wendy. But the truth is that laparoscopy is very expensive. Okay, so most of the things that we feel for to say, if you got most of us have to say that we have laparoscopy. So I mean, we will do it for you if you can afford it. You can come around
All right,
and
thank you.
give you a deal. Thank you.
All right, thank you. So let me leave you with this so that we can leave you to go and continue your activity. He says Doc is very good at what he does. I visited the facility on Monday, and I must say the place is so serene and nice. Doc and the nurses are welcoming, caring, and good at what they do. So as Sister Wendy said, go and visit. And then she even added your number. So
Wow.
this is a
Hey, what's the
testimony of
name?
the welcome. This is a testimony of the welcome that she got when she came there. So she's sharing her experience. God bless you so much. Like I said, originally we would need an appointment to come and see you. But you've opened your doors to us, and we are grateful. I mean, we still need an appointment, but you are just there is the rate at which you just respond to us and welcome us with open arms. We are very, very grateful because we all know that everywhere in the world, and you're gonna
Yes.
pimple, but everywhere in the world, a doctor like you would need an appointment, and it takes a while to be able to see a doctor like you on these premises. So yeah, Jima, my dear, please, is myomectomy surgery deadly? That can one die from surgery? I didn't want to ask, but I realized that she asked that I should ask, so I'm asking.
Then when they knew that someone like this, someone have told them that mastectomy surgery is deadly, but
Oh
please,
yeah, Ubewu.
stati- statistically, I don't know, but statistically, there's people that are out of mastectomy surgery, so it's almost near. Unless there's an underlying condition. Mastectomy surgery is
Unless
so safe.
yes,
It's so
unless there is
safe.
something. Excuse
Underlying
my French, but you stayed
condition,
home and had some serious complications,
complications.
and it's you.
Maybe
So you
somebody,
probably died from the complication, but not the.
yes, yes, maybe you are in the house, you have father taking herba. Your kidney is being destroyed without the knowledge of anybody. Okay, but myectomy surgery itself, I mean, it's so safe. It's so safe. It's not a complex surgery at all. It's so safe. Okay, so please, don't let anybody put fear in you. Okay,
Not allow
and
anybody
someone to
to
ask,
say.
also ask a question that what is the dear doctor, please, what is adenomyosis in fibroid? All right, so let me get to this thing. Adenomyosis simply is a kind of fibroid. Simply means that you see the walls of the uterus. Okay, we have some tissues and some tissue in the in the inner walls of the uterus. Sometimes they find themselves inside the fibroid growing. Okay, that's what we call adenomyosis in fibroid, and I mean it does not change the treatment plan. The treatment plan at all. Surgery is just enough for medication, and then you are good to go. Yeah.
All right, doctor. Thank you. So, is the absence of any further questions? In fact, I intended to take just one of your time, but I'm sorry, bro. So thank you
Okay.
very much. So
Thank you very
next week
much.
we'll be tackling fertility. So within the week, I'll be giving people the opportunity to share their fertility journey like they did with the fibroid journey, so that by the time you come, we would know. I mean, we would have our questions ready, and people would also learn from the experiences of others. And so when you come, I know that you probably can't use just one I one and have to tackle fertility because
Yeah. We could do it in budgets like this one. We can just
yes,
education on
because
fertility.
we
The
want to
other
know
time,
about IVF. We want to know about IUI. We want to know about if I am unable to carry pregnancy, what are my options? And we would want to know about everything. And then we would want to know about like fertility when it comes to genders, like the men and the women, because the idea that once these couple are not having kids, it's because this week there was a case in my inbox. I
okay.
yeah, I think yeah, there was a case, and I'm trying to remember if it was even a phone call because the person needed someone to talk to because she's been trying so hard to get pregnant, so hard for years, and she has been the one to sponsor herself, although she's married, and then after years she's now realizing that it is the man who is not capable of
Mm, mm,
fathering a
mm,
child, and
mm,
and all this while he
mm,
has been in the known,
mm.
but she has allowed this woman
Yeah.
to go through
Mm,
she's gone through hell. So
mm,
next week when we start, I want you to educate all of us that when you are starting your fertility journey, if by any reasons you think like, okay, I'm finding it difficult to get pregnant, tell us and let us know that we start together as a couple. It's not just me, the woman, that will present myself to get
mm,
examined. It's so that the both of us will get examined. So right from the word go, we know who and how to tackle the issue. So
mm.
those are some of the things we would want you to tackle aside the science aspect. Tell us some of them. I know you have a lot of experience in what I'm saying. So next week when you come, teach us with your science, teach us with your experiences. But I'll give them the platform all week to share their fertility journey. And
Yes.
then some of the stories I know you are busy, but there are some I'll personally send to you so that you also
Exactly.
read them and then you would know.
Great, great. So next week we'll do the fertility as what Amedi have said, and then flowing through it, we'll do the part two of it, and I'm sure that will be a blessing to you. But what I want to say is that if there are going to fertility problem somewhere, there's still life at the end of the tunnel. Don't give up and don't get discouraged and don't let anybody intimidate you or pressure you. It will come at its own time. Okay, have that faith and have that. We've helped you faith over 51 years by God's grace to have a child. So don't
Wow.
get don't give up. Okay. But let me put our numbers online so that those who want to
Please
come
do.
to us,
I'll
yes,
still put it. So you mention it and then I'll go and post it.
yes. So all those who want the surgeries, to do your best, call us. Let's book appointment as early as possible so that just the
Doctor,
50%
talking
discount.
about the surgery, let them know there are timelines because there are a number that
Mm,
we are looking for. Because there are a
mm,
number that you are looking for, and then the time of the surgery, let them know the when the surgery is starting and when it's ending, and then the
yeah.
time. Nipa say ni ehwɛ. So if you want to come, just come and let's start with the process so that we would know.
Yeah. So the allocation that I and my team were able to give to Wendy was 100 patients, and already the people have come next week and they are very close. And so let's see from now to the end of the month, all those who we booked, we can work with you. Okay, that's the 50% discount for those who will be available. So all those who have this who need a surgical procedure. One patient came here and he said that she went to a government facility for surgery and she has been booked to somewhere August or so. The surgery should be
Mm,
done. Yes.
yeah,
But she was
yeah,
booking me. But she was booking me for
mm,
August. He told her,
yeah,
please come. Within 1 week,
yeah.
if that thing we can do it for you, or the condition, your blood level, your parameters are okay.
Okay,
We can even do it for
yeah.
you the same day. Okay. So when you have it, come this should do your best. Contact us tomorrow and then Monday. Contact us, book an appointment. Once you come over, by Tuesday, if we can all be here, by Tuesday, I'll be here with the gynecologist and also other the medical team on Tuesday. You can come around, we'll attend to you, and then we can schedule you for the surgery. Okay. It's very important. So if you want to contact us, our number is 030-285-6781. Let me repeat this again. 030-285-6781 for our landline. Our other number we have is 054-364-2726. 054-364-2726. You can contact us and then come here at any time. And look, or you can just mention Wendy's name. If you don't mention Wendy's name, then I mean, what's your full money?
Please, I go
It
use me
will
as
back.
reference. So use me as
And I say,
reference.
use Wendy's name. Once you use Wendy, okay, we have this social contract with Wendy, and that will also give you the the package we want to do. To. And we're also
Let
calling on helpers and donors who can finance people who want to do it, but they don't have the means. You can support them
I
so
was
that we
going
can
to
do
go
it.
there.
Yes, so if you are
I was going to
out
order. So
there,
you already have some. I told you about the money that is sitting in my accounts. At least some 13,000 something is sitting in my accounts because someone sent it for you. And then another lady said she was willing to support. I'll contact her if her funds are ready. And then this week too, I'll mention is if people are willing to support us because some even with the 50%, some will still struggle. So if they can support us,
some
so that
will still,
this
some will still
yes, so
struggle.
that
Yeah.
this will be made. Doctor, I want to tell them how I met you. So doctor contacted me through a friend. Through I got to know doctor through a lady. Her name is Benis. Benis is doctors. I don't know, but Benis really advocates for doctors. So she said, I want to help society. I want to help women. Like all those expensive procedures, the IVF, the IUI, the fibroids, they are so expensive with these private facilities. I've done my own checks. I have my own facility. I want to do it for them at a subsidized price. And I wanted to ask if you'd be willing to support and how in quotes how what I would take for I say me. My hands are Apple. If
Yes,
you need me
yes,
morning, I'm up. If you need me afternoon, if you need so far as you want to do these things for women and help them, you didn't even
yes.
think about your revenue, your gains, but you are putting them first, then I'm up. Doctor is off, but I think we are done. So that's how I got to know Doctor. He's just willing to help for free, willing to help for free. So I think we will wrap up now and leave you. Next week we'll be tackling fertility like we discussed. So let me have all your fertility questions and fertility journey. So Doctor, your last words to us so that we leave you alone, please.
Yeah. So all I would say at this very juncture is that um, we are here for you, okay? And we don't want finances or money to limit you from having good health care. The little that we can do, the little God has blessed us to do, we are here to help you get the best health care and at a very, very affordable. I mean, trust me, it's okay. So put in your best, come over, and then with the help of the foundation of Wendy, what's the name of your foundation?
Redeeming Hands Foundation.
What?
Redeeming Hands. I will test it to you now.
Redeeming hand.
Yeah,
Okay,
so
redeeming hand. Okay, okay,
RHF.
okay, great.
Yes,
Great,
RHF, yeah.
great, 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 great. I'm going to give your foundation name to the team of surgeons who will be coming to Ghana. They have to
Thank you
know the
so
good, the
much.
good work that you are doing.
Thank you
With
so
redeeming
much.
hands, yes. I mean, redeeming hands is doing so fantastic because I was actually surprised now people who came there, messaging me. I was like, wow, really? If your platform is that influential, they will use your platform to reach out to the right people. So
Yes,
please,
yes.
I've spoken to the doctors, all the team involved. I've let them to know that we the Yama society is
Yeah. You mentioned.
daily patrol.
I didn't want to put it all out there, but I could even say more. I remember the conversation we had. Like,
Yes, so I've spoken to the team, all the gynaes who are on board anesthetic. Because in surgery, you have to pay the gynecologist, you have to pay the anesthetics, you have to pay the nursing who the assistant who will be helping the surgery. You have to. I mean, it's a whole lot. It's a whole lot for a successful surgery. Okay,
yeah.
but then
Yeah.
I've spoken to all the team, and they are really ready to really provide that to
This is
society.
literally free because you are flying doctors from
I mean,
outside Ghana to come and
it's
help with
literally
this.
free.
It's
It's
literally
literally
free.
free.
It's literally
It's
free.
literally free. So please, don't let money stop you. This opportunity, let's do this and do it well. And trust me, God will give you the divine health you need. And those who want children to know you can come, we will help you. We'll see the best package we can give to you. We'll see how the best treatment can give to you. And next week, by this time, we'll be here again. Share. I pray that I wish Wendy can send the link ahead so that those who will begin to share the link. Is it possible? I'm not
Yes,
so
I
much
will. No, no, no,
textile.
I will because if we'll be using the YouTube link, then we can do that. Don't worry, we will figure it out.
So that they can be shared and so that people who will get will be prepared towards it ahead. Okay, let's reach out to people. I need to tell someone to tell somebody to
Yeah.
come over and take that replace. When we put our line on our number online, and you can contact us at any time. Thank you very much, Wendy. God bless
Thank
you
you,
so much.
doctor. Enjoy your evening. Father, in the
Thank
name of
you.
Jesus, we thank you for a successful program. Thank you for your grace and your mercy in Jesus' name. Amen. Thank you very much,
Amen.
doctor.
Bye
We will talk back. Bye bye.
Exactly. And I wish you to the recovery
Thank
for
you.
your healing. God grant you divine healing. Amen.
Amen. Amen.
All right. Bye bye.
Bye. Thank you guys. So thank you all for joining us. Thank you. Next week we'll be tackling fertility. I know fertility is a big deal for most of us. So like doctor said, tell a friend to tell a friend that this is something you don't get anywhere. You don't get a fertility specialist to come online and spend like between an hour and 2 hours with you and tell you and answer your questions and give you opportunities to ask the questions and he addresses them for you. So you don't get this anywhere. He's doing this for us for free. He hasn't taken anything from me. He's doing it for free. I haven't taken anything from him. I'm also doing it for free. We are both just of health conditions. So please, next week, join us. Let us discuss fertility. But before that, if you have a fertility, like, share your fertility journey with me, what you've been through. Share the journey with me. Let people know what actually, maybe aside the science part, what are words, what are actions as a society, what it does to a trying to conceive couple. What's the like the things, people that don't know what you've been through will just say anything like that and just wafani huedi. So this entire week, kindly share with me your fertility issues so that we can address them. Whilst you're doing that, I'll put doctor's number out there. Contact him if you want to be part of this up and coming surgery program. So thank you very much. God bless you. Enjoy your evening. Bye.